little sayings, once again from the lesser writings, The Cure and Prevention of Scarlet Fever. And this was his opinion of people who didn't believe in preventing infectious diseases. But if its efficacious prophylactic power has incurred or may still incur opposition from prejudiced, ill-disposed, weak-minded and cursory observers, I may be allowed to appeal against their conduct to the more matured investigation of the clear-sighted, dispassionate portion of the public, and to trust to time for a just verdict. I should esteem myself happy if I should see, some years hence, this scourge of mankind in any measure diminished by my labours. Now, I do believe that Hahnemann gave us a gift from God, not only in treatment, but also in prevention. Hahnemann passionately believed that the divine presence, however one talks about her, gave us the tools to actually deal with illness and disease and to prevent disease without harming the person. People say, first do no harm. That was Hahnemann's mantra, and he's given us these opportunities to do that. Thank you very much.
Thank you, Dr. Isaac Golden, for your elaborate lecture on how to overcome the challenges in epidemic research homeopathy. We had been actually, you must have heard that in Andhra Pradesh, the Japanese encephalitis was treated and prevented through Ballerona. In Delhi, when I was the principal of Nehru College, we distributed phosphorus as preventive, and it was given to large number of people. And in Madhya Pradesh, I know I have learned through the Central Council for Research Homeopathy, Madhya Pradesh, very good work is being done on prevention of malaria. And in dengue also we have done some work. In some hospital we also did some work. But the only thing is that we have not evolved a proper strategy to substantiate that work scientifically. There is good effect, but how to develop a confidence among practitioners? Whatever research we do, wherever we do, if it cannot infuse confidence among the practitioner, where he can put his own children and give homeopathy prophylaxis, I would feel that our success is not complete. So we have to do that. It's very important. Recently I met one of the very internationally famous immunologists. He said one thing, I was very much impressed by his words, that you have done very good work. Large population, good effect, good stories, good success stories. Success story in the word of success stories, without having real scientific evidence. He told me, Dr. Gupta, if you keep a serum prior to giving prophylaxis, and after the epidemic is over, then again collect a serum, and then this serum can be preserved for many years, 10 years, 20 years, even if you do not able to find the mechanism how it has prevented. It is likely that after 5 years, 10 years, we will be able to develop technique how homeopathy medicine is able to present. Homeopathy medicine is in a non-material doses, what we call ultra-diluted dose. And I met one of the scientists of what you call quantum physics. I asked, he was quite conversant with the homeopathy medicine, potentized medicine, which is very important. People, how to say that, what is the potentized medicine? How to define potentized medicine? When it comes to the definition of potentized medicine, it becomes difficult. And I tell you, I'd like to share with you. He told that he is a PhD in quantum physics in America. He says, homeopathy potentized medicine are two quantum vital energy medicine. And that makes a lot of sense. How many of you know it? If you say to somebody, it will make some sense. My point, he told me that if the serum is kept, we will be able to do a lot of studies, whether to present knowledge can explain or not, but future knowledge will be able to explain. So this is my request to the DG, that whenever we do, we should be able to have all parameters thought well in advance. When epidemic occurs, it is a crisis. panic ho gaya, give anything which you like. And at the end, we are left with no scientific data. If the scientific data is there, the scientific world will get convinced and the government can be pressed because everybody knows that potentized medicine are safe. But are they effective or not? That is very important. That has to be explained on the basis of these parameters which are accepted world over. So, I thank you and I now request my co-chairman, Dr. Martin Brand. Before I request him, I would like to have questions.
I just want to mention one thing, that prior to all this research, we need to a standard protocol.
Yes.
Without standard protocol,
Very right.
our work can be reorganized by the scientific world.
Very right.
So I request Dr. Manchanda and all the scientific institute and the government, standard protocol is the first thing. In our personal experience, I do 30 years work on the leprosy. It is known to everyone that the gain of sensation is not possible in leprosy. After multi-drug, they can only check the transmission, but regarding sensory loss, nothing. So this is the main problem.
Yes.
But we have produced a standard protocol, and we validated this with several projects funded by Ministry, Research and Factor. And after that protocol, it is now accepted. So like this, if we do all these things, then nobody can challenge.
Thank you.
We have to
Yes.
protocol.
Thank you very much. Ultimate, whatever research we do, ultimate aim is how my practitioner develops the confidence to treat X, Y, Z disease. And that is the ultimate of the entire research program. So that has to come up. Now I request our worthy co-chairman, Dr. Martin Brand, to summarize.
Sir, I have to say one thing.
Question, any question?
Yes. I am Dr. Lohar, former Director, Homeopathic Pharmacopoeia Laboratory, Ghaziabad. First, I will congratulate to Dr. Manchanda for enhancing the quality in the research of homeopathy. But whenever we are talking on the research in homeopathy, we are always discussing clinical parameters. But here I would like to add one more thing, that there is a fundamental research is also very important, and
Yes.
that is required. So there are two things. First, the manufacture of homeopathic potency, and second is detection of homeopathic potency. In these two areas, the fundamental research is very essential. When we are discussing about the manufacturing of homeopathic potency, there are two methods. One is by mechanical jerks, giving 10 mechanical jerks and we are raising the potency. And second is by vibration method, automatic potentizers. If you see, both methods are not standardized. When we are raising the potency by manual vibrations, it varies from person to person. The strength of the vibrations, the strength of the jerks, and the timing of jerks are not standardized. And second thing, in case of the automatic potentizer, again, how much number of vibrations we are giving, what is the timings, and what is the strength of the vibration. So all these things require a fundamental research to standardize the method of potency preparations. So then only we can get, otherwise the potency will vary from manufacturer to manufacturer, person to person. Second thing is the detection of the homeopathic potency. Now, at present, we don't have any device to differentiate between, say, for example, pulse filter 30 to pulse filter 200, 200 to 1000. So, in this area, again, the fundamental research is required. Second thing is, we have to differentiate between the pulse filter 30 and Berberis 30. If somebody give a wrong labeling to pulse filter 30, we don't have any device to differentiate whether it's a pulse filter 30 or Berberis 30. So all these areas needs a fundamental research, and in this Central Council for Research in Homeopathy can play a very important role. So I would like to request to our DG CCRS to kindly take this area also besides the clinical areas. Thank you very much.
This comment, you can summarize. Any more questions?
Just a comment. Okay, I will try to summarize the main thoughts which were displayed this morning. Dr. Manchanda, he first focused our attention on the research challenges, that the limit of our research literature is still there, and also the way we use the modern media to interact electronically is still limited. There have been some reports which were critical of homeopathy. The Science and Technology Committee from the House of Commons in the UK and the Australian Medical Research Committee also had, in my opinion, quite a biased survey of the homeopathic literature. If we look at our specific homework, which we can make and perform even better facing these challenges, Dr. Manchanda focused our attention on the study process itself while generating clinical evidence, and also the quality of the studies, which should be appropriate, reliable, valid, responsive, precise and interpretable. And they also should be specific for homeopathy. The model quality is validating its theoretical framework, and it should be comparable with the conventional system. Because we have a specific model and we should make our methods appropriate to that model. Secondly, there are several levels of evidence. Usually meta-analysis are used to try to show an overall evidence of a whole system of medicine, which is at odds with the fact that it's being practiced daily. Secondly, there are trials which are used as the golden standards because of the idea that groups should be homogeneous, comparable for an intervention or a placebo intervention. Secondly, our practice is used in an open situation, therefore many authors have relied on open studies, and we specifically in homeopathy, we use case studies. There is a big distance between case studies and a meta-analysis, and there have come up guidelines to document case studies in a reliable way, and also standard criteria for publication have been published. We have the home case guideline, and we also now can propose standard treatment guidelines, so-called STGs. Another issue is the quality parameters for the reporting of the RCTs, which may not always be appropriate for the homeopathic way of treatment. Every study in effect is usually counteracted by skeptics, because there would be not fundamental research showing that homeopathy has an effective an effect in models which are used to support scientific evidence in medicine. But at the same time, India is contributing as a third party in the Homebreaks database. The last decades, only Brazilian Brazilian studies are more numerous, but India has a great capacity to contribute to basic research, and Dr. Manchanda advocates we use this momentum because India has a huge capacity for research, has very qualified researchers and good institutions. Because basic research should support clinical applications. And one example is the effects of sulfur to induce apoptosis in non-small cell lung carcinoma, which was published 2 years ago. When we look for fundamental research, we also look to the quality of the production process. And there are still some questions to be addressed, like the seasonal influence, the nature of the trituration process, the succussion process, and these areas deserve wider further attention and further in-depth research. When we want to show the empirical basis of our work, is homeopathic pathogenic trials. And as far now, 97 drugs have been proved in the toxicity phase, the phase number 1. And the next step is symptom-specific drug validation, because a lot of people are being treated with homeopathy in the centers of the CCRH, about 100,000 patients per year, which is in itself a huge opportunity to make a database for this, these treatments. And there is a journal of International Journal for Homeopathic Research being published by the CCRH, and we can show the effects of all these patient contacts per year. So the main conclusions were from Dr. Manchanda: we need high quality research and we need efforts to develop our research community further. I think I hope I ventilated most of your conclusions. Dr. Golden from Australia focused at the challenges of epidemic research, which I think are highly relevant in the Indian context as well. The Australian Medical Research Council formulated an attack on homeopathy. They supported it by one film, Just One Drop, which the title already is indicative of how they try to diminish the importance of homeopathy, but they use apparently a quantitative paradigm rather than a qualitative paradigm, because they think that just one drop certainly not is enough, and we have another vision on this